How do you know if a test or a procedure is right for you and your birth? How can you be sure that you know all of your choices before agreeing to a test or procedure so that you don't feel railroaded or just put on a factory assembly line? Here are the questions that you need to ask to make sure that you know all of your options before consenting or refusing. Welcome, I'm Ellen Contard.
And I'm Melissa Evans.
We've been supporting growing families for a long time.
We've come to realize that quality childbirth classes are really hard for growing families today, both in terms of calendar and budget.
So we've decided to do something revolutionary. We are offering our full, comprehensive childbirth class series right here.
Please realize that we are not medical providers nor attorneys. We do not practice medicine nor the law.
So use common sense and talk things over with a professional that you trust.
But for now, let's go over some key questions to make sure you get the individualized care that you deserve during your pregnancy and birth. Sometimes care providers will simply announce that they're going to do something. It's kind of like getting a toddler to bed. We say, hey, it's bedtime. We don't say, would you like to go to bed? And when working with toddlers, it's, a decent approach. But when working with adults, it's a little bit demeaning. What your care provider is really doing is asking your permission. May I do such and such? Which means you have the right to ask questions and even say no.
To be honest, we hate the idea of informed consent. So often it means I'll give you enough information from my perspective and you'll consent. Even worse, sometimes it means you signed a paper that means you gave informed consent. The truth is, you are an autonomous adult, and informed refusal is absolutely a thing that you can do. However, saying informed consent and refusal is kind of clunky, so we like to say informed decision making.
How can you decide if a test or procedure or intervention is in your best interest as an individual? Here are the key questions to ask.
The first and really foundational question is, are mom and baby okay? Hint, if they're talking to you, y'all probably are. In an actual emergency, the care providers probably won't be talking to you. If they're afraid for life or limb, they're going to be working very quickly to do whatever needs to be done. So if they're talking to you, it's probably not an emergency, and you do have choices.
Then ask, why would you like to do or use this? If the answer is just because it's policy or routine, you might want to think a little bit more critically to see if it suits you in your unique situation.
The next question is, what are the expected results? What are the benefits of this test or procedure to you?
The other side of that is, what are the risks? Your job then becomes to take those benefits and those risks and to weigh them. But if you don't have a complete picture, then your scale's not going to be calibrated correctly.
Once you have that information, it's time to dig a little deeper. Are there any alternatives? What are other choices that could potentially meet those same benefits? This is where choosing a care provider with a big toolbox is really important. If they don't know the available alternatives, they're effectively limiting your options. And of course, once you know what alternatives there are, you're going to be asking those benefits and risks questions all over again for each option.
One option that deserves some special consideration is, what if we do nothing? Is a little bit of patience all that we need in this situation? Is just waiting a viable alternative?
Something that is often overlooked is, what else will happen? If I sign up for procedure A, am I also signing up for B, C, D, E, and F? We don't want to get blindsided. We need to look at the big picture. So, as an example, let's look at the decision to use an epidural during labor. So the medications in an epidural can often make a mom's blood pressure start dropping. So the first thing that we need is an IV with fluids to help keep mom's blood pressure up. This also helps mom stay hydrated because she's now no longer allowed to drink anything. We'll be monitoring her blood pressure continuously to see if it does start dropping. A pulse ox will be placed on mom's finger in order to make sure that the heart rate being monitored is the baby's and not mom's. Speaking of which, the baby's heart rate will be monitored continuously, usually using external fetal monitoring, to make sure that the epidural is not adversely affecting the baby. The second half of the external fetal monitor is the tocodynamometer, which measures the existence of contractions. Note that I did say existence. The external toco cannot tell you anything about how strong those contractions actually are. Now we can do what most people think of when they think of an epidural, which is the catheter of medicine in the back. But wait, there's more. Mom can't get up out of bed anymore, so she can't go to the bathroom by herself. Therefore, she's going to need a catheter. Mom's labor can slow down because of the epidural. For this reason, Pitocin, or synthetic oxytocin, is often administered to make the contractions closer together and stronger. As you can see, getting an epidural is not a simple process. Do the benefits of an epidural outweigh the risks? Potentially. It is a tool, and sometimes it's the right tool for the job. However, this information is good to know before you get all tied up.
You don't have to fall for the high-pressure salesman thing. A really important question is, can we have a moment to think about this? Whether or not you're religious, asking for a moment to pray is a really easy way to get some privacy so that you can make the decision from a peaceful place instead of feeling like a watched pot.
So let's run through this process using an IV as an example.
Are baby and I okay?
Yes, you're both fine.
Why would you like to do this?
Well, in case of an emergency, we want access to a vein.
What are the expected results?
Well, we expect that you will stay hydrated throughout your labor.
Are there any side effects?
It is common for mom to experience some swelling, including in the breast tissue, which can make it a little hard for the baby to latch on. Also, the baby's birth weight can become a little bit inflated, and as that water logging drains off, it can look like baby is losing weight too quickly, which can cause concern and pushing of supplements, which can also disrupt breastfeeding. There is a chance of infection at the IV site, and there's usually some discomfort while we're placing it.
Are there any other options?
Well, you could drink to stay hydrated during your labor, and a saline lock could be used that would give us access to a vein without you having to be connected to the IV pole.
What if we do nothing?
We would be very concerned in case there were an emergency. In the event of a hemorrhage, it's really hard for us to start an IV access when veins aren't really at their full capacity.
What else will happen?
Well, if we use an IV, then you will need to be connected to that pole and take it with you wherever you go during labor. Also, because we already have access, it's kind of easy sometimes to put things into that IV without having a whole conversation about it. In birth particularly, synthetic oxytocin can be run after the baby is born, and some moms don't like that.
May I have a moment to think this over?
Of course.
Of course, having a solid education before going into your birth is really important. That way you already know most of this information about those common interventions and choices that you'll have. Yet even the most thorough education can't prepare you for every possible circumstance. So learning how to maneuver through those other choices is a really important skill.
A simple acronym to help you remember the high points of the informed decision-making process is BRAIN. Benefits, risks, alternatives, intuition, and nothing.
From the book, The Attachment Pregnancy by Laurel Wilson and Tracy Wilson Peters, they give a much more right-brained approach to this. The first job is to separate yourself, to quiet your mind in the environment, and then listen to your heart and your gut. Once you make a decision, commit to it.
You will be given a ton of paperwork to sign in a hospital setting, and you're usually asked to sign it when you arrive, even if you've pre-registered, and you're in labor. Admittedly, that's kind of irritating. You should be able to ask for a copy of any paperwork ahead of time. Read it over and make any changes that you feel are necessary. After all, it is a legal document.
This is the paperwork that was given to me when I went to go see a counselor when I was trying to heal from a traumatic relationship. So I'm sitting in the mental health building, quite frankly feeling a little bit self-conscious, and I'm reading through this document. It says, I consent to treatment by this particular medical group, provided by and under the care of the attending physician, his or her associates, partners, assistants, designees, other staff, and or contracted medical providers. I consent to any and all inpatient hospital and or outpatient clinic care, which encompasses diagnostic examination and procedures, including but not limited to X-ray examination, laboratory, anesthesia, emergency room services, medication, blood transfusion, blood component, drug testing, removal and disposal of tissue, nursing or medical/surgical treatment that my physician, his or her associates, partners, assistants, or designees may deem necessary or advisable under the general and special instructions of the same. This was a care provider who didn't even have prescription writing abilities. So now I'm sitting in the mental health building, and now I'm feeling paranoid on top of everything else, but I couldn't sign this. So instead, I changed it, that I consent to all of those things that the doctors and my husband or myself deem advisable. Oh, and then they don't discriminate, and they get paid, and they get paid, and they get paid. Priorities. Happily, they did not bat an eye when I handed them my personalized altered copy.
So there you have it. What do you think? Are there any questions that you would like to ask? Have you ever declined a test or procedure? If you did, how did that go for you? Please tell us your stories in the comments. We really look forward to reading them.
Be sure to like this video and share it with all of your pregnant friends. And don't forget to subscribe. We'll be dropping new classes every Tuesday and Friday, and we don't want you to miss out.
So until next time,
Know your options.
own your birth.